Pop quiz number 486. A client's brought to the emergency department with partial thickness burns to the face, neck, arms, and chest after trying to put out a car fire. The nurse should implement which of the following actions for this client? Select all that apply. All right, guys, how to treat select all that applies as true or false? Let's go. 1, restrict fluids. False. When it comes to burn patients, we are going to be very concerned about dehydration. We're going to be very concerned about shock. We're going to give the patient fluids. They're going to get IV fluids. We're not going to restrict fluids. False. 2, assess for airway patency. Absolutely. Look at where they have burns to. Face, neck. We're worried about inhalation of that smoke, of those noxious gases that can literally close up that patient's airway. We have to make sure they have a patent airway. So that's true. 3, administer oxygen as prescribed. Absolutely. We want to make sure that that patient has perfusion. 4, place a cooling blanket on the client. No way. They've got burns over their skin. The skin, which is the first barrier of protection for that patient. They're going to be losing their body heat, right? So we want to make sure we keep that patient warm. We want to prevent them from going into shock. So we're not going to put a cooling blanket on them. That's false. Next, elevate the extremities if no fractures are present. That is true. Why? We're worried about dehydration because all the fluid is going to the tissues, which will cause edema. And so the reason why we want to elevate the extremities, we want to, 1, decrease the edema, and 2, that fluid that the patient has, we're trying to bring it back to the heart, back to the body so perfusion can increase. Choice number 6, prepare to give oral pain medications as prescribed. No, we're not. We absolutely are not. That patient's going to be NPO because we don't know if they have to go to surgery. Pain medication is very important, but they're going to get it intravenously, not PO.